Ade, okay, no, okay.
Okay, good day, everyone, depending from where you are joining. I would like to welcome all of you to our webinar, the Pharmacy Scholars Initiative webinar, today, 29th of November, 2025. So before you proceed, as usual, we normally give an overview of who PSI is. So PSI by name is Pharmacy Scholars Initiative, and it's a mentorship network for pharmacists with a common interest in research and career development. It was founded in December 2017 and is currently registered with the Corporate Affairs Commission of Nigeria. And we have our members from different parts of the world. As we know, we have a little announcement here. This webinar is being recorded, as I mentioned at the beginning. So at the end, we'll share the link to all the participants and as well as the general, our social media outlets. And at the end of the webinar as well, we'll send your certificate of participation via your emails. Also, if you have any questions, you can always use the chat box to send your observations, suggestions, and questions. And yeah, the agenda of the meeting is like the opening remarks, which I'm equally doing it at the moment. And then, and then we have the main.
Sorry to interrupt.
Yeah, I'm trying
I
to.
think somebody's mic is unmuted. Yeah, from the screen. From
So we have the presentation, which is to be given by Zayyan Shitu, and then that will be followed by question and answer sessions, and then we have presentation of certificate, and then we have the closing remark. And in today's webinar, we are having Zayyan Shitu, who will take us on a very important and trending app that is, I could say, is very important for anybody involved in healthcare. Before going on, I would like to introduce our speaker today. I have a little slides here. Okay, where is it? Yep. So that we should know who our speaker is, so that we'll have good. So our speaker today is Zayyan Shitu, who has a master's and MPH, and he's a current supply chain specialist at MEBS Global. Zayyan is a clinical pharmacist with experience in public health, pharmaceutical services, humanitarian work, and supply chain management. And he holds B Pharm from Hamdard University in India, and a Master's of Clinical Pharmacy from UNISA in Malaysia, and an MBA from FLU in USA. He previously served as the Director of Pharmaceutical Services with the Zamfara State Government, and later worked with MSF on humanitarian health programs. Zayyan also partnered with many international development organizations, especially Society for Family Health, on projects related to HIV prevention and treatment. Zayyan currently works with the MBES Global as a supply chain specialist, supporting malaria, HIV, and COVID-19 programs. I'm also to add, Zayyan is one of the co-founders of Pharmacy Scholars Initiative as far back as 2017, and he has been an active member since then up to date. Join me to welcome Dr. Zayyan to the podium to make his presentation. Dr. Zayyan, are you sharing your slides?
Thank you. If you have it, you can
No, I
share.
think
Thank you very much for.
if you have, you can share.
Okay.
Otherwise,
Okay. Let me do that.
okay.
Stop
Thank you.
sharing from there.
All right, I did.
Thank you. I don't know if the screen is visible now.
Yeah, I can see it from my end.
Okay, thank you. Thank you, Dr. Ibrahim, for the warm welcome. And thank you, everyone. Good morning, good afternoon, good evening, depending on where you're joining from. It's a pleasure to be here to present a little work I am doing, little but impactful, together with Commonwealth Pharmacists Association, an association that actually is for pharmacists practicing in the Commonwealth country, and also doing some humanitarian work as well as developmental work in ensuring they improve pharmaceutical practice in these countries and globally. Before I proceed, Mr. Chairman, permit me to wear two caps as a PSI
Yeah,
member, active member, as well as the Commonwealth Pharmacists Association.
that's fine.
Thank you so much. So these are the contents of our presentation. Understanding the antimicrobial resistance, which is a basic knowledge that most of us have. We're also going to look at the global burden as well as the antimicrobial resistance situation in Nigeria, number and the magnitude, and how prudent prescribing can actually, how non-prudent prescribing can actually fuel antimicrobial resistance. It's a duplication. And also we have to we'll look at the SPAC app. We'll get to know what it means, the work stream of the prescribing companion, as well as how countries' resources are developed within the app, and how we can navigate and download the app for our usage at various healthcare settings that we operate or we practice from. Sorry, this here. Antimicrobial resistance as a basic knowledge, and taking us through this for some of us who are not in the healthcare uh, uh, settings as relates to our practice. But these are basic knowledge. We all know antimicrobial resistance occur when microorganisms no longer respond to antimicrobials. Antimicrobial resistance or antibiotic resistance, as other people or they are being called by other scientists, uh, is actually usually occur as a result of accelerated misuse, overuse, or poor infection control. Misuse, and in the sense that easy access of patients to these drugs, which tends to lead them to use this drug anyhow they like, which is very prevalent in our society, as we all know. And overuse, this is prevalent because of easy access, as well as the fact that some of those prescribing these drugs tend to overprescribe them to the patients, whether inpatient or outpatient. We tend to see a lot of multiple prescriptions of antibiotics or antimicrobials. Knowingly or unknowingly, these practitioners are actually fueling antimicrobial resistance because these usage are not prudent, and they are not justifiable in many cases. Another thing is we suffer is for infrastructure for infection prevention, our waste management, our handling of rapid diagnostics, lab commodities, procedures in hospitals usually contribute to this uh, antimicrobial resistance because of the way we handle procedures. We tend to transfer infections from a patient that has it to a patient that doesn't have it. in our facilities, especially during surgeries. We have seen cases in lasers. We have seen cases in so many cases in hospitals. People go there to get treatment, ended up getting infected. The unfortunate part is getting infected with a resistant variant antimicrobial, which will lead to harm. So these AMRs, when they occur, they're already resistant, hard to treat, and they lead to high cost of treatment. And in many cases, mortality and death to the patient, because when they resist to treatment, it usually leads to uh, complication and death, leading to major threats in surgery, maternal and infectious diseases. It matters because, as I said, infections become harder to treat, and there's increase in treatment failure, and of course, the threat in modern medicine. Globally, in 2022, there is 1.27 million deaths directly caused due to drug resistance. This is given by World Health Organization. And also, the WHO also equally reports the resistant key antibiotics, which are the most commonly resistant antibiotics, fluoroquinolones, as well as cephalosporins. These classes of antibiotics are the most resistant classes that were reported. And also, as I mentioned, it leads to a lot of economic loss. Economic loss in the sense that when there's resistance, there has to be an alternative or a second line usage of drugs. And this usually render the first useless, the treatment useless. It actually leads to longer stay in the hospital, which leads to uh, high cost of treatment. And when accumulated, it's actually amounted globally, according to the data given by the WHO, to 3.4 trillion loss. That is being projected up to 2030, if average is taken up to that level. So, as I said, longer hospital stay and also uh, many effects to the patient. In Nigeria, uh, resistance are common in ampicillin, ciprofloxacin, cotrimoxazole. You know, if you look at it carefully, these are drugs we easily have access to in chemist, pharmacy, and also they are the type of drugs that are easily prescribed or overprescribed by our medical practitioners in the hospitals, knowingly or unknowingly that this could actually be the effect. These are the key contributors, as I mentioned, over-the-counter access to antibiotics. Another key challenge is inconsistent guidelines and adherence by the patient. And as I've mentioned earlier, weak infection prevention control. So as this impact are being seen by the Federal Ministry of Health, there has been a development of action plans. This action plan, this first action plan, National Action Plan for Antimicrobial resistance, was in early, I think, 2017, run down to 2020, if I'm not mistaken, which actually had its objective in ensuring reducing AMR resistance. And also there's a national action plan, which will run up to 2026. That is National Action Plan 2. Key information from this action plan is in the first action plan, we have neglected or not put in consideration the One Health approach to this menace, in the sense that we have focused so much on the human antibiotic resistance or antimicrobial, neglecting a very important aspect of it, which is the uh, animal health as well as environmental health. A lot of antibiotic usage are actually being done in the animal. In fact, in recent times, the animal health use antibiotic a lot to the extent that uh, I don't have to mention all our meats are becoming agric-based in the sense that not homebred as they used to be. We have a modernized system of farming where we treat animals with a lot of antibiotics. Unlike the human, the infrastructures are not available. These drugs that are being used to treat animals are not being prescribed. They are not being used prudently. They are being used in high dose to the extent uh, when these animals reach our abattoirs, they come with high uh, content of this antibiotic, where we ended up consuming them because not much measures are being taken in this process to ensure safe usage of this farm products. And in the other case, they tend to have the resistant variants, these animals, and then we tend to consume them because some meats are not well cooked to the extent that we kill all the microbials. We tend to develop this resistance. So the National Action Plan tend to increase awareness on the One Health and tend to have a more One Health approach and a prudent prescribing in both human, animal, as well as environmental health. Non-prudent prescribing behavior uh, without diagnosis can lead to resistance. The use of broad spectrum agents when narrow spectrum agents are supposed to be used, incorrect dosing and duration of treatment combination. Also pressure from patients and caregivers. And in our case, it's not even the pressure, but easy access of this medication. How do the stewardship uh, help? Let me give a very clear context. Stewardship simply means prudent prescribing or usage of antimicrobial by the healthcare practitioner. So this prudent use promotes evidence-based antibiotic use and ensure the right drugs, right dose, right duration, and right routes being utilized during the administration process of this drug, and also uses audits, feedback, guidelines to improve practice, as well as strengthen collaboration in One Health, as I have mentioned earlier. We have a program, sorry, we have a program uh, called the CW Pump, which was introduced among the Commonwealth countries in 2019. CW PAMS simply stands for Commonwealth Partnership for Antimicrobial Stewardship. It's a program that is being implemented in 13 countries of the Commonwealth, and it's looking at improving stewardship and prudent use of antimicrobials in the hospitals. In Nigeria, this program started in 2021 after COVID, with few selected tertiary facilities being implemented in. And this program determined during the process of implementation did notice one gap, and this gap is non-utilization of national treatment standard treatment guidelines. If we work in the hospitals, we do notice that we have these treatment guidelines available, but hardly being utilized by our healthcare practitioners. These guidelines are supposed to be at the desk of the doctors, the nurses who administer, the doctors who prescribe, pharmacists who dispense and mostly review these medications, supposed to have these guidelines for his own reference review to ensure the right drugs are being prescribed. These guidelines are usually not utilized at the hospitals. Why? Because they are cumbersome, they're not easy to carry, and we easily get them lost. And you know, another key challenge is they're expensive. We print them, moving them from Abuja, and it's a central procurement process, which is being done at the federal ministry and then being transported to the states and to the PHCs, as well as secondary care and tertiary care institutions. So it's a cumbersome process. Sometimes they get missing at the ministries, or if they get to the facilities, they are not being utilized. So the idea of an app came into existence because an app, everybody used their phone recently. So the Spark app program, which is basically surveillance and prescribing support for antimicrobial resource capacity, started in 2022 to bridge this problem of non-utilization of standard treatment guidelines, which is key and very important because this app being developed in the 13 countries, Nigeria inclusive. And this app will help us in having easy access to these SDGs, basically focused on antimicrobial drugs. But these apps are designed in a way we'll get to see that. Basically, for now, the content of the app, treatment guidelines for human health, treatment guidelines for animal health, as well as infection prevention control. And these guidelines are both international guidelines and national guidelines. So these guidelines are being uploaded carefully, reviewed. As you know, the standard treatment guidelines is on already established reviewed document by the Ministry of Health. So it's on already standard document. So these guidelines are being uploaded on the app to ensure. So this is how uh, the app looks like if you download it on the App Store or iOS. For those who use the iPhone, for those who use Android, you can go to the Apple Store. You type Prescribing Companion, and you get to see this very logo here. That is what you should download. In the next slide, I'll be able to give you the barcode, which you can easily scan. That will take you to the site. So the app, as I mentioned, has the treatment guidelines available. And the beauty of it is once you download the app, you can be able to access these guidelines even if you're offline. You know, we have a lot of resource limiting settings, especially in the villages, these PHCs. So it's made in the sense that once you download it, you don't need internet again to access this document. As I have mentioned, you have resources, international AMS, that is antimicrobial stewardship and infection prevention control. And also it's designed in a way that it can have country ownership. Each country can use this app the way they want, depending on the diseases predominant in that country. We can determine as a country what you want to put in, what you don't want, and you can also utilize it beyond antimicrobial usage. We have other pressing issues. We can also uh, upload all essential drug or essential all types of essential treatments that we have beyond AMS or beyond antimicrobials. We can put whatever we want on the app depending on the need for the policymakers in the country. And as mentioned, it has a One Health approach because it has a component for animal health, which can be used by our veterinary doctor to improve the prescription process, and also foster sustainability and training. These are the countries where the app are currently available and live. You can see Nigeria there clearly, Zimbabwe, Bangladesh, and these are 13 countries of the Commonwealth. Even though this is an old data, it's having 92,000 active users. This is at the beginning of this year. I'm sure the most current data will actually showcase a much bigger active users of this app. So this is how the app is being developed. It followed all the relevant procedures. App champions are being recruited. I'm one of the app champions in Nigeria. We are two. The other one is Mr. James Yakubu, based at the Ministry of Health. And we identified a treatment guideline that is the most recent, because we have different versions, the most recent and up-to-date version of the treatment guidelines. We uploaded these treatment guidelines onto the app. We have a back end login details provided by us where we can, depending on the approval given by the ministry, we can upload and put all the resources that are being required, and also all the guidelines being required. We can upload them there. And then the governance here, we have to check to ensure the accuracy and relevance. We have an in-country consultants who go through the nitty-gritty of what we uploaded to ensure, and this is an expert who was a director at the Ministry of Health, ensure that we have uploaded the right document, and then gives the final approval for the app to go live. And then after that, the app is being launched. I'm happy to say that in Nigeria, we have launched the app this year officially by the Minister of Health, represented by all the directors at the Ministry of Health. The Director of Food and Drug, Director of Pharmaceutical Service was there on 25th of July. We launched this app. So officially, this app can be downloaded and used by our healthcare workers. So this is how you can download the app. This is the barcode if you're using the iOS, as I mentioned. And also, the app can be utilized using the web instead of the app, depending on the resources you have at hand. If you're the type of person that love a bigger screen, you can easily access it using the web version of it to have a bigger view, and if you have the resources at disposal. So yes, next we can all go ahead and download the app and also navigate the national resources. What you need to do is, once you download the app, you only have access to the international treatment guidelines. So once you go to the bottom of the app here, yeah, this very section that is circled in blue, once you click it, you go to this other section. You click, you will be able to see all the countries' guidelines: Kenya, Nigeria, Nepal. So you download the Nigerian guidelines. Once you are able to do that, you can come back and then you realize you have both the international as well as Nigerian guideline. If you are able to move to any of the country where it's listed on the app, you can also download and utilize, or you want to make references with that. So this is how it looks like. This is an example of the Kenyan app. You can see the infection prevention diseases, you see the animal health here, and you can see the COVID-19 sources available at this thing, as well as see the international antimicrobial stewardship. You will see the national guideline, African Union guidelines. All these guidelines are available. So this is how it looks like once you're navigating through. You also have a search button. If you want to make things easier, you can easily have the keywords put on the search buttons and easily. Yeah, so these are the country toolkits as mentioned earlier. So these are the few positive feedback we've had on the app from individuals who have downloaded and utilized the app. Basically, it's just to showcase the app of to the prescribers. So in a nutshell, this is essential, not just for antimicrobial, but most importantly in this moment, because this is a very crucial time to ensure prudent usage. And also, it's important to all healthcare workers. All as pharmacists, you can make reference to ensure the right drugs are being dispensed, the right drugs are being prescribed. As nurses who administer these drugs can also cross-check, as we say, from the first users, if we do make references, we cross-check this prescription, there will be improved patient safety. And also, we are not just doing it to that patient, we're improving the entire public health setting, because one patient with a variant resistant variant can actually affect an entire population. Thank you so much. I'll stop here at this moment. Really appreciate all your audience. If there are any questions, I'll be happy to attend to. Thank you.
Wow. Thank you so much, Zayyan, for this amazing presentation. And it was very informative and educating. Thank you so
Thank
much.
you so much.
Just to add to what Dr. Zayyan presented, antimicrobial stewardship is like becoming I would say a widespread or like a global approach to improve safety use of antibiotics. Like in where I am, uh, like dispensing or prescribing, dispensing and use of antimicrobial or antibiotics in general is a very strict procedure. Number one, from the doctor who is prescribing and to the pharmacist who is dispensing. Like I could remember in the Royal Hobart Hospital, um, the if there's any script on like an inpatient script for involving an antibiotic, the script has to go through like an antibiotic specialist pharmacist to check it to be sure that everything is inappropriate, like it has been um is for the intended infection, the dosing, everything, like he has to make
Yes,
sure that everything is in
exactly.
order before he now give like
Yes,
approval for the pharmacist to dispense. So if the pharmacy dispense, then there's another final pharmacy that who will do the final check before now dispensing the medication to the patient. And even at the point of
exactly.
administration, the nurse has to be very, 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 like they have like a checklist where they follow to administer an antibiotic. And as we all know, over here, I would say you will never ever get it over the counter just the way we do back home. I think
Yes,
the simplest one is the one that you can go and have a consultation with a pharmacist, and the pharmacy. That is, and even the pharmacy has to be an expert. I mean, specialized on antibiotic
Mm,
prescribing. So, some pharmacists who with those certification could prescribe some few antibiotics. I think is Septrin and nitrofurantoin for UTI. Yeah, but all of that ones just
mm,
undergo this stringent process before you have it. And all this is just in order to improve the antimicrobial safety and to prevent
yes.
resistance. And like here, if you have an infection, it is very expensive to treat. So I think it has also have some pharmacoeconomics point of view in addition to the pharmacovigilance. So thank you so much, Dr. Zayyan, and I would like
Thank
to
you.
welcome questions, suggestions, and if you have any question that you would like to ask, you can just use the icon to raise your hand or to pop any of your questions in the chat box. Meanwhile, while we're waiting for the participants to start sending their observation and questions, I don't know if I missed it. Zayan, as the regular questions, is this app free?
Yes, it's very free
Okay,
and easy to do. Once you go to the App Store, you can easily have access. But uh, we want healthcare expert to have this app to prevent misuse by people who are not expert in the field, because it's one thing to make reference and it's other thing to understand. Even while reading the treatment guideline, you have to have some certain level of formal education for you to be able what the guideline is talking about. So it's free, but we tend to promote it carefully to healthcare professionals.
okay. And
Yes.
another question for me is, so what you are talking is like it's a mobile app.
Yes.
So you
It's a
don't have any
mobile app,
option
but
for Windows?
there's there's a web, yeah, there's a web version, Windows version also. So you can go to the web and type prescribing companion. It will get you all the informations you need. If you don't want to use the app, you can use it on the
On the
web.
laptop?
Yes, on your laptop, you can use
Oh, okay. And it's like regularly being updated, is it, if I may ask?
it. Updates are being done continuously. If we have, you're talking about update on the app.
Like update because this is like an ever-changing field. Like so, if
Yes,
there's
yes. So
any, just
that
like
is why that is why we're here as the app champion. Once there are, let's say there will be a review of the national guideline this year. So once we have the updated copy, we'll have to go and update. Updates are done continuously
oh, okay,
on the app. And if we want to add treatment guidelines beyond antimicrobials, all we need is get approval from the ministry, and then we ensure these updates are available on the app.
oh, okay, that is very
Yes.
good. And just
Yes.
trying to make this thing a little bit more. So this app, I think it could also be used in addition to those who are already in the field, even to the students, like who are in the
Yes.
clinical. Yeah, yes, I think very
Yes.
this app it will be very handy for you to have like up-to-date
Yes.
information on this antimicrobials. I think I have a question here.
Yes.
I will ask like if Nigeria had any standard guidelines for this medication disposal practices, especially leftover and expired medication in patient custody. I think this is a little bit partly not related to this and also related to in case if the medication is an antibiotics. So yeah, he's asking if we have any guidelines for disposing like expired medication,
Yes.
this medication.
When you look at the the first feature of the app, especially the international guidelines, you see there's an IPC section, Infection Prevention Control, and that covers waste management. If I get the question right, he's talking about waste disposal, right?
Mm.
A critical aspect of infection prevention control because we tend to utilize rapid diagnostic tests, we utilize lab commodities, but we don't dispose them appropriately. And you know what that causes? You
Mm.
use them on somebody who is infected, you tend to dispose them inappropriately, and then transmit a variant infection or resistance to the community through non-standard practice of infection prevention control system. So this app has all these resources that you go through. Sometimes it's not a search bar that you can easily download these resources from the app, and then it will give you a guideline on how you dispose different hospital equipment that are being used and consumables, syringes and everything. So
All
yes,
right.
these are available on the app. And if not available for Nigeria, we can seek approval to ensure we upload them for the Nigerian guideline.
Okay, like Zayyan, there is a big question here, which I'm very sure most of the participants would love to have. They have possibly expecting this in the webinar or something similar. But before asking the question, I just want to add information to the answer you give. So I'm not too sure, like okay, I will speak based on my experience here. So in Australia, they have like a national program and I could say a guideline, which is very well implemented on, they call it return of unused or unwanted medication. So each
Yeah.
pharmacy they have, and most of the hospitals they have what you call a RUM bin. They call it
Mm,
RUM, return
mm,
unwanted medicine bin. It's like a big bin. So patients from home, if they're using expired medication, unused medication or leftover, they normally, or if maybe the patient died at home, so they normally bring the medication back to the pharmacy. So as a pharmacist, it's like your professional responsibility and duty to receive those and safely dispose them in that wrong bin. And there is one for tablets, capsules, and there is another one for injectables. And then for the S8, that's the control medication, we normally put them in the safe. Then we now have some time to dispose them properly based on the available laws. So yes, they have a role there. And if I could remember in PSI, we have like a research team purposely for this disposable medication.
yes,
In fact, the
yes,
research
yes.
team
Mm,
even conducted research and like trying to pilot to see the possibility of like practically implementing this in Nigeria. And I think we even published a paper on it. Yeah, and I think I'll
yes.
check and
Mm,
see if the
mm,
paper is share the link.
mm,
So
that's
it's
right.
possible. And thank you so much, Zayyan, for the information. So this the guy is asking Kamal, like, would you please like take us through hands-on on how the web version of the app looks like just to play around it a little bit for them to have the practical look at it, if that is possible.
Okay. Okay, let me
And I think that's also what I would love to
see.
see.
My screen is still
Yeah, we can see it, yes.
okay. So yes, if we can see,
Yes.
this is the web version.
Okay.
Yeah, so once you type prescribingcompanion.com, will get you to this page. So you get to see the countries, and most importantly, you get to see the international IPC and AMS guideline.
But
So
can we go
you
into the
choose,
Nigerian one, please?
yeah, so this is the Nigerian one. You go into it and you see the options, infections and infectious disease, other common clinical condition. See, I also have a section that will redirect you to the international uh, AMS and IPC interventions, animal health, and then we have other national resources. Let's say you choose what to click, say infection and infectious disease prescribing. See how easy it is. There's a search button here. Let's say you are uh, on duty, hurriedly wanting to prescribe. You don't have to go through section by section searching, but also the section by section is done the national SDG. You can see cardiovascular disorders. Mark you, these are disorders of cardiovascular that requires antibiotic mainly. That is what we uploaded here. The CNS, dental and oral disorder, ear and nose, condition. So we can pick one and click all the conditions related to the ENT. You see, and once you go into so each and every one, national treatment guideline, epidemiology, etiology, clinical features, all the things you need. And these are the treatment guidelines, the dosage required for it according to the national treatment guideline. So you can see it's the notable adverse drug reaction and everything is here. You can easily go back. Yeah, the web only works when you have internet connection, while the app, once you download the app, you can easily access all of this without internet, depending on where you are working from. So this is how it works. Otherwise, you can easily come here and uh, I'm just giving an example. Whatever you search according to the words, you have it at the drop down and you can access it easily. So that is how it works. I
Also,
hope this is
yeah,
satisfactory.
okay.
But
Did
if
you
you
have
can
like,
go back, you can
okay.
animal health. We have uploaded a lot of guidelines for the treatment of, according to the national guidelines for the use of antimicrobials in animals. You can see them here. You know, that is according to uh, the guidelines. You can easily access them also. Okay, there's a problem here. Okay, these are technical issues, but we'll make sure I escalate it there. But they're available for downloads.
But Dr. Zayyan,
Thank you very much.
also, if is there anywhere you can contact, like the user can contact you guys through the
Yeah, yes.
through
So
the app
if you
or the
look on
web
the
app?
there's an email given for easy contact of the Commonwealth Pharmacy Association AMR program. On the app, you will see it, and also there is a survey section where you can give feedback because it's an app. Let's face it, comes with issue. Last week, I was promoting it as at a PSN conference, and we had a glitch. People were not able to download, but these are technical issues that occur here and there, and they get to be fixed. That's why Commonwealth did not do it alone. We have an IT solution company called Tacom that collaborate up together. So when
Thank you very much, Dr. Zayyan. I think
thank you, sir.
I will, can I think I can ask my question.
Yes, go ahead.
Yes, sir.
Yes. You see, in fact, in Nigeria, just like the presenter rightly said, the issue of the rampant use of antimicrobial agents in animals, most especially for people that rear chickens and view. In fact, you find out that almost every household is now having a poultry farm in it, and then they get this antibiotic easily, and these antibiotics are used on a daily basis. Some of them as growth promoters, some of them to treat some form of infections in the chicken. But one thing I realized is that this the women, our women don't usually know that this will definitely have what do you call it, consequences and implications. So they thought it's the right thing. And I think that's an area where the government needs
Yes.
to look at to control the sale of this antimicrobial agents and antibiotics, most especially at you find them very common among what do you call it,
Yes.
within our streets, our environments, and people get them. You can get normal pure water. So I think probably the present more light and what he think can be done to curb this menace.
Yes.
Thank you very much.
Thank you so much, Doctor. I appreciate. You see, it's just as if you have entered. We're sharing the same thought. Having antimicrobial stewardship will help in the healthcare setting. However, we have a bigger issue as a country of not having a controlled supply chain in the pharmaceutical industry. As you are aware, drugs are easily accessible. Particular problem of easy access to medications, both animal and human, are a bigger contributors of resistance in Nigeria. Not just resistance, every other problem related to drug misuse in the country. So I believe that is a separate intervention that we need to look at. We have been discussing this in a long time, but know the effect. But sorry to say, nothing much is being done regarding that. Some states are taking individual actions while others are taking a different action. Policies differ from state to state. System the supply chain in Nigeria. That is why we have the open market and we have all these problems everywhere. So I believe that is an area of a serious concern that requires a serious intervention if we want to really stop and other drug misuse. Thank you.
Thank you so much, Dr. Zayyan. Also, to add to what you said, I want to share also another experience here. And I think there is a salmon farm here in Tasmania. And I think they had some issues with some of their fish were have been like infected or have some infectious disease. And these guys, they have to seek not even state approval. They have to apply to the federal government, like Ministry of Agriculture and Ministry of Health, to get an approval to use an antibiotic in the aquatic, like where the pond are. So, so they got approval and then to use the antibiotic in their own farms, and then they use even after that, some people here, the locals, they protested like the company is using an antibiotic and that will like bring some antimicrobial resistance, blah 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 blah. They made like a protest, and the government has to come out and clearly explain to them the implications, like there is no any direct danger to the community, to the water, to everything. And the company were given, I think, up to 30 days for them to start, like, um, um, how do I say, doing business with those fish. Like, they have to monitor them at all the stages of the during the antibiotic use. The biosecurity department from the government has to be coming to the farm to be monitoring the progress of this antimicrobial use and everything related to it before they give them final approval to start harvesting the fish to the market. I'll share the link so that you guys should read to see how serious this issue we are talking is. So thank you so much, Zayyan, and yes, what you said
Thank you. Thank
is
you.
so
Thank you
that
so
is
much.
I just shared the
So
link.
this is the issue I was talking about. Here, you realize, you go to the Ministry of Agriculture, they're the one in the activities of the veterinary and as well as the animal health and farms. And we don't have uh, a process where there's a meeting point between the animal health and the human health. We do, but it's insufficient, especially in the area of the supply chain. I know there's a lot of chaos going on because there's a need to introduce pharmacists into the veterinary pharmacy sector. And if I'm not mistaken, this is done with a good heart to actually seek less an expert secure the expertise of pharmacists in that sector to ensure prudent usage. But people in that sector will see it as a threat, and that lead to a lot of back and forth. I think there has never been the discussion again. So the problems as uh, problem,
Yeah, I
before we are able to
yeah,
resolve
I
this.
think on the final questions on observation before we move to the next item is one of our senior colleague, Samini Falilu, who is currently in Kuwait, and he asked a very important questions, which I wish you guys have a very adequate funding to do like a nationwide upscaling of this app. So his question is, do you have any plans of engaging various AMSC committees in our various hospitals, especially in the tertiary hospital, to help in promoting this important app? I wish you guys have a funding so that you can go around the
Very, very,
country
very
targeting these bigger
interesting.
hospitals.
Yeah, it's an interesting question because these are supports. Ideally, innovation that is supposed to come from within, but nevertheless, uh, outside. And now, the words I got from the directors of the Ministry of Health is that the ministry is taking ownership of this app, and also we are now by December 27 the funding for this app is going to end. So the program, as app champions, we are actually ending in 2026. So that being said, means every program has a beginning and has an end. It's up to the nation to build, take ownership, and also scalability of this program. It's just like setting a foundation for something for someone, which is the most difficult part of the whole project, and ensuring they complete it within themselves by giving them all roadmap and the guidelines. So yes, they have done their own, and we have history to take ownership, and we are available to ensure more promotion of the app in the tertiary and in the institutions.
All right, thank you so much. Though, and another thing is, it might be like there might be an issue of bias, but I would suggest possibly if you can include all these bigger pharmaceutical companies, like to have it or to fund some part of it as part of their social corporate responsibility. Like the way they do in Australia, these are run being, like I said, the return of unwanted medicines is partly
Mm,
some of the bigger pharmacies like Sigma, which is one of the biggest pharmaceutical company here. They are partly involved in like disposing the unwanted medication. So they supply the boxes, and when if, anytime like the boxes are filled, so you like arrange for them to come and collect it. In fact, the way they even go beyond like the REM now, they are even going further to use to be collecting the blister. The blister, if you use like Ampiclox, so that's the blister that you throw away. So they are now collecting it, and but for that one, they are using it like they are recycling it. So they are doing it for furnitures and other things. So instead of you dropping it away, and you so when you have like medication, all the paracetamol, Panadol at home, you finish all the blisters, you now put them in a bag and bring them back to pharmacy. So each pharmacy has a box, like a box, you just come and open the box and put it inside and you go. So when it is full, the pharmacy will now arrange with those companies to come and take it. But they recycle it. All right, thank you so
yeah,
much. Zayyan, in the absence of any question, is Samini Falalu around, please? Sir, are you around? Samini Falalu. Anyway, maybe he's a bit far. I'd like to call on Dr. Uh, Abubakar Eswada, who is our new head of pharmacy, I said head of department, clinical pharmacy, Bayer University, Kano, to help in presenting the certificate of appreciation to our speaker. Famwada, are you there?
Yes, sir, I'm around.
Yes, so I've just presented the slide. If you can help in presenting it to Zayyan, please.
Thank you very much, sir. Um, and to my presenter, Dr. Zayyan Shitu, it's a singular honor to present this certificate to you, certificate of appreciation by the Pharmacy Scholar Initiative as a token of appreciation to a well-presented topic. We really appreciate the presentation. This presentation is timely, and then we hope it's going to be beneficial to all healthcare personnel and even our students. We really thank you for this presentation and wish you the best of luck. Thank you.
All right, thank you
thank you
so
very
much, Dr.
much.
Yana Izja will send you the 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 certificate into your email address. Thank you so much, Wada, for this.
Thank you
We
so much.
appreciate
I
it.
appreciate.
I
Thank
think in
you.
the
I
absence
appreciate.
of yeah, so like I said, and we'll share a link where we are asking you to provide your email address and name. and then we'll send you the link to the webinar recording and your certificate of participation. And if the speaker permitted, we'll send you the lecture notes. And if it is protected, then you only receive the lecture notes and your certificate. And also, if you would like to reach out to us, you can reply to the email, then we'll respond to you at most suitable time. Thank you so much, and we really appreciate your presence and see you. Just a reminder, our 8th-year anniversary will be in December 20th, and the same time on Saturday, 11 a.m. And we will be having our speaker, and we'll be talking on the career reinvention. And he is like an international renowned motivational speaker, and he's a medical doctor, and also is a director in Tasmanian Health Services. So it is like a luxury that he published a book on career reinvention, and it's going to be launched in January 21st. So I think I received the invitation today. So please, it's a luxury that doesn't want you guys to miss it. And all what I will say is see you then in December 20th. Thank you so much, Zayyan. We'll catch up later. Thank you so much, everyone. Bye-bye.
Let's endeavor. Sorry, one last thing to all. And then thank you all. I appreciate everybody. Thank
All
you.
right. All right.
Yes, sir.
Bye-bye, and see you when we see you. Thank you so much.